Good afternoon, everyone. A very good afternoon once again. Welcome to MGM Healthcare's Facebook Live Kids Health Talk, a series of talks from MGM Children's, the Department of Pediatrics and Neonatology at MGM Healthcare, Chennai. We try to bring to you once a week talks from pediatricians, pediatric super specialists, and associated specialists on talks which we think that parents and families may find useful on topics related to children and their health. Today we have with us Dr. Radhika Ramesh, a, a fetal medicine senior consultant. Now, what is this fetal medicine? She is a specialist in doing ultrasounds on pregnant mothers and looking at their babies. So, when mothers are pregnant, the baby is called a fetus, and this specialty is called fetal medicine. We trust you have found our talks useful so far. We thank you for your support. This helps us to bring you more talks on more useful topics. You will continue to find these on Facebook and YouTube whenever you want to access them. If you have any questions during this talk, please feel free to enter into the chat box and we will be happy to get back to you. Dr. Radhika is giving, this is her second in a series of talks. In the first talk, she talked to us all about scans in pregnancy, an overview of scans in pregnancy. How many scans does a mother need during pregnancy? What does a mother need to expect during these scans? In this talk, she's going to talk to us specifically about the anomaly scan. Many of you would have heard about this, the 20-week scan or the anomaly scan. So Dr. Radhika is here to talk to us all about the details of the anomaly scan. What does a fetal medicine specialist look at in an anomaly scan? How does a family take it from there if there is anything abnormal in the anomaly scan? What all do we take a look at, how it helps us in the pregnancy, and this forms a very important part of care of pregnant women. Over to Dr. Radhika. Welcome, Dr. Radhika.
Thank you, Nisha. A very good afternoon. So, last session we went through an overview of what all scans we do in pregnancy. So, now we'll focus on a 20-week scan. So, what is that magic number 20? Actually, it's not exactly a 20-week scan. So it is in the mid trimester. In the pregnancy, we divide into 3 trimesters, like first, second, and third. And the second trimester, mid trimester, would be the anomaly scan. So when a family comes or a pregnant mother, she comes to the scan room, and I tell her I'm going to do an anomaly scan for her. Immediately she's terrified. What is this? Why an anomaly scan? So it kind of creates a very negative feeling in the mother. So that is, the doctor is trying to find out something abnormal with my baby. It is not so. 98% of pregnancies are normal, and 98% of the pregnant women, they deliver a healthy normal child. About 1 to 2% of them do have problems. So to find out that 1 to 2%, we need to scan all the pregnant women with the same attention. So we find out the 1 to 2% of the problem women. So why that magic number 20? It's not exactly 20. It's somewhere between 18 to 22 weeks. The reason is the baby is kind of almost fully developed. All the organs are well developed. It's easier to see because baby weighs around 400 to 500 grams at that time, and it moves around freely. There is good amniotic fluid. The mother is comfortable to lie down. So all these factors kind of make us easy. For us, make this easier to see the baby, so we can see the organs in detail and make sure everything is fine. And also there's other reason for the 20-week number. Why not 24? Why not 28? Because the baby is bigger at 28, and it's easier to see the heart, easier to see the bowel, easier to see the kidneys. But the government, according to the health ministry, whenever we find out a major structural defect in the baby, which may or may not be compatible with life, when we want to end the pregnancy, the rule says that we cannot do terminations after 20 weeks. So that according to that guideline, as well as the ease in examining the fetus, we have this golden number 20. So anywhere between 18 to 22 weeks will be the anomaly scan. So most of us prefer to call it as a target scan. That's a TIFA scan rather than calling it an anomaly scan. And It's mostly for reassurance. As I told you, 98% of the women have normal babies. Only 1 to 2% will have babies with problems, and we have to really scan with in great detail all the 100% of the women to find out the 1 to 2% for scans. So that's why we prefer the 18 to 22 weeks scan, which is otherwise called the mid-trimester scan, otherwise called a target scan, which also is called TIFA, that is targeted scan for fetal anomalies. So mainly we look at the physical appearance of the baby during this scan.
Thank you, Dr. Adhika. That really gives us a clear picture about what the scan is all about and why we do this at this particular time. So, going to the next question, what are the common anomalies we see when doing a 20-week scan? Can you give us an overview?
Yes, the common anomalies would be fetal
Neural
cranial
tube.
in CNS anomalies, that is central nervous system anomalies, which would be which otherwise we call as open neural tube defects. The most common one would be anencephaly. That is when the skull of the baby is not developed. That is diagnosed mostly 100% in anomaly scan or even earlier. The other common central nervous system defect would be the spina bifida, that is open spina bifida. So there is a defect in the spine vertebrae, and also there is a protrusion of the nerve fibers from the spinal cord. There is a skin defect in the baby. So what happens is the nerve fibers kind of get exposed to the amniotic fluid and they get damaged. So the baby's spinal cord actually gets damaged, and the baby's functions of the limbs and the body becomes disabled. So that's a very serious defect, causing a significant morbidity to the baby. It's not a life threatening anomaly, but still the baby will suffer a long term neurological problem. So this is the most common anomaly which we find out during the mid trimester anomaly scan. The second would be a facial anomaly. So most of the pregnant women is concerned that I want to see the baby's face. Is the baby's face okay? In my family, somebody had a problem with the upper lip. So the most important cosmetic as well as having a very significant impact on the baby's life would be a cleft lip and palate. That the baby's face we can see very well in an anomaly scan. So that is which common anomaly which we can diagnose during the 20-week scan. The third would be abdominal wall. So as we all know, the umbilical cord is attached, one part of the umbilical cord is attached to the baby's abdomen, the other in the placental side. So during that attachment and development, there are certain things which can go wrong during the process. So the bowel can protrude into the cord that is outside. The bowel may not stay inside the baby's abdomen, causing abdominal wall defects. That is, the bowel which should stay inside the baby's abdomen is actually outside, causing bowel damage. This anomaly may not occur alone. This can occur along with many other abnormalities, and that will cause a significant problem to the baby. The baby will have to undergo a major surgery after birth, and after surgery also, the baby will have to undergo many problems before it goes to a full recovery. And sometimes even the liver can get out of the abdominal wall through the cord, and those babies will have a hard time in the surgery and they may not survive also. The other common abnormality would be cardiac defects. So the cardiac defects are very common than we think it is. And we do not go by any particular reason to look at the heart of the baby in detail. Like we look at the face, we look at the limbs, we look at the spine, we also look at the baby's heart in detail. So we pick up the major cardiac abnormalities in a 20-week scan. Among the abnormalities, next to the or open neural defects I told you, cardiac anomalies also contribute to a very significant number of birth defects. Then the next common defect would be the urinary tract abnormalities. They are very common. The the renal abnormalities range from very mild to severe ones. The very mild ones are usually not of much concern because most of them kind of resolve before birth, or they do not cause significant morbidity after birth. Some abnormalities like blockage of urine, that is the kidneys accumulating urine, not letting it drain, those kind of abnormalities can be treated after birth. But sometimes what happens is, if the one kidney is damaged and the other kidney is fine, those babies are perfectly compatible with life, and they can be managed very well postnatally. Sometimes what happens is both the kidneys do not develop well, and both the kidneys are showing signs of obstruction. Then those babies are definitely not compatible with life, and this is the main uh, component of our anomaly scan, is to document both the fetal kidneys are structurally normal. So then comes the limbs. Mainly when you look at a cardiac anomaly, nobody is going to know once till the baby is born, and the baby is going to look normal at birth, whereas face and limbs are the one which has cosmetic attention also, because when the baby is born, first thing they look at the face, they look at the limbs, and majority of the parents are concerned if the baby's face is okay, limbs are okay, all four limbs are there. The common major limb malformations like the upturning of the foot, or the one presence of one limb, or limb reduction defects, all can be diagnosed in a fifth month anomaly scan, because that's a crucial time, because once a baby grows, it occupies the space in the uterus and not much space to move, whereas in a 20-week scan there's good liker, it'll keep moving keep moving the four limbs. So we'll be able to trace out that all four limbs are developed well, and the common limb anomalies we can diagnose. So these are the common malformations which we see during the 20-week anomaly scan.
Thank you very much, Dr. Radhika. That gives us a really good overview of what are the anomalies that you look at and what we can find. So, asking you the next question, which will probably be the top of any parent's mind: does the finding of anomaly, mean termination or ending the pregnancy?
Um, Finding an anomaly does not always mean termination, because as I told you, the common anomalies, most of the babies can live, except for conditions like where the baby's skull is not developed, or both the kidneys are not functioning. The conditions like these are not compatible with life. The baby will die soon after birth. So in those situations, termination would be an option. Whereas even in conditions like the spina bifida, or a large cleft lip or palate, or cardiac defects, most of these babies are can live with treatment. That is, they will require some major surgery or treatment after birth, but they can live for a long time. But we have to look at, living is not only the uh, option we are looking at. The quality of life for the baby, the how the baby is going to cope up, how it's going to suffer, how the family is going to get affected, we need to take all this into consideration before thinking of what to do with the pregnancy. So as soon as I tell a pregnant woman that the baby has got an anomaly, it means I've found out a problem. That directly does not mean termination. I've come across many situations that after finishing a scan, I tell the pregnant woman, "Oh, I see a problem here, and I want to look at you more. I want to do some further testing. I want to refer to a specialist." Then immediately what happens is she goes in for a termination immediately. So she should not jump into such decisions. So an anomaly does not mean termination. An anomaly is finding out a problem. Then we need to kind of group the problem, find a cause of the problem, and whether it can be sorted out or not.
Yes. So thank you, Dr. Radhika. We will take us down this further path of what we do down this once anomaly is found out. So, for our next question, is there any other testing that any further testing apart from scanning?
Yes, 90% of the diagnosis is by scanning only. So we actually examine the fetus by ultrasound, like somebody is examining a newborn. The further testing would be, once we find out a problem, we want to know whether the baby's chromosomes are normal. So because most of the anomalies, we do not know what is the etiology actually, and it can be sporadic, that is just like that it happened, or environmental influence, or multifactorial, or we don't know the cause, many causes put in together. So actually, we cannot point out why an anomaly happened, because that will be the common question a couple is going to ask me, like why it happened, why me, what I could have done or what I could not have done this to happen. So there's not much they can do about preventing the problem, or making having a baby with an anomaly. So the one test which is available is, we can study the baby's chromosomes. That is, the actually most of the anomalies can have a chromosomal cause. A chromosome is what we find in the blood. All of us have 23 pairs of chromosomes. So if there is any extra chromosome in the blood of the fetus, or if there is less or more chromosome, then the development of the baby becomes a problem. So what we can do is, we can test for the baby's chromosomes. How we do it is, most of the baby cells are present in the amniotic fluid surrounding the baby. So we do under ultrasound guidance, that is, we look at the fluid, the baby, and we look at a baby free or a cord free pocket. We take some fluid and send it for chromosome testing, which could be a karyotype or a microarray. So these tests will look at the baby's chromosomes, and it might tell you why the problem happened. If it is a chromosomal problem and the baby has got a physical defect, then it is more serious problem. The baby is not likely to have, suppose the baby has a cleft lip and palate, I can counsel the couple saying that the cleft lip and palate can be operated by a multidisciplinary team, and the baby can do well. But if the cleft lip and palate baby also has a chromosomal abnormality, means the overall development of the baby is going to be a problem. So in that case, the couple might opt not to continue with the pregnancy. So to find out why it happened, and to make decisions regarding continuing the pregnancy or ending the pregnancy, further testing like karyotyping or microarray will help.
That's very clear. Thank you, Dr. Radhika. So further down, the next step. Now we found that there is an anomaly. We've done karyotyping that will help us with our decision making, and so I could you give us an overview of how you approach an anomaly in the pathway?
Uh, First, we have to give the option of anomaly scan to the pregnant woman. So first, we have to explain. all the special when they have problems with each system, they go to a different specialist. And the fetal medicine specialist